the way we are. Because doctors and nurses should be making these decisions, not insurance company bureaucrats. And I'm going to tell you a quick story that illustrates why I feel so strongly about this. I could tell you probably 500 stories, but I'll just tell you this one. I was in southern Ohio campaigning along the banks of the Ohio River in a small town there. And I was meeting with some local residents, and one of them was a deputy sheriff. And he told me this story about a young woman from that town who went to work at the pizza parlor. And she made minimum wage, and she sure did not have health insurance. She got pregnant. And she started having trouble, so she went to the nearest hospital. And I do not blame the hospital, because every hospital in America, just about, provides a lot of free care. So the hospital said, we just can't take care of you unless you give us $100. She said, I don't have $100. They said, well, we can't see you. She went home. About a week later, she came back, same response. We need that upfront money. She went home, and the next time she came to the hospital, she was in the ambulance. And the hospital tried very hard, the doctors and the nurses there, to save her baby, but her baby died. And then she had to be airlifted to the nearest big city and medical center in Columbus, Ohio, where for 15 days the doctors and nurses tried to save her life, and she died. Now, I believe that it is morally wrong in America that a young woman and her baby would lose their lives because they couldn't get health care. That, to me, is unacceptable in our great country. But it also doesn't make any economic sense. By the time the two hospitals tried to save the baby and save the mother, hundreds of thousands of dollars were spent. If she'd got preventive care, if she'd been examined and maybe something had been done to help her, that money would not have been spent. That money was spent on her behalf, and we all are grateful it was, because that's what we do in America. We try to help people even if they come in through the emergency room and it's too late. But think about how much better that money would have been spent. Making sure she had health insurance, making sure she had prenatal care, making sure that when she showed up at the hospital, they could afford to take care of her.